Hi everyone, our lecture today is about a scalp. As you can see in this picture, this is the calvaria. The calvaria represent the upper part of the skull, and sometimes it is called the skull cap. The calvaria consists of frontal bone, two parietal bones, occipital bone, and part of the squamous part of the temporal bone. So the calvaria represent the bony part of the skull. The calvaria covered by a soft tissue. This soft tissue called a scalp. So the scalp represent the soft tissue that covered the calvaria. Now we will talk about the layers of the scalp. In order to assist in memorizing the names of these 5 layers of the scalp, we can use each letter of the word scalp to memorize it. As you can see in this picture, the S represents the skin layer. This layer contains hair follicle and sebaceous gland. The second layer is the connective tissue layer. The C represents the connective tissue. This layer contains fat and fibrous tissue. It is rich in arterial blood supply, which are branches from the external and internal carotid arteries. The third layer is the aponeurosis layer. This layer connects the muscles together or the muscle to the bone or cartilage. It is a thin tendon sheet. Okay. Now also we have L, which represents the loose areolar layer. This layer contains loose fatty tissue and is responsible for the mobility of the scalp layers. Finally, we have the periosteum layer. This layer is responsible for the nutrition. As you can see, the P letter represents the periosteum. Now we will see these layers by details. As you can see in this picture, this is the Gallia aponeurotica layer, which represents the aponeurosis layer. It connects the frontalis muscle to the occipitalis muscle. Also, we can see this is the loose areolar layer. Okay. Now we will talk about the muscles of the scalp. We have occipitofrontalis muscle. These are 2 bellies of the frontalis muscle. These bellies are larger than the occipitalis one. The origin of these bellies from the skin and superficial fascia of the eyebrow. The insertion to the Gallia aponeurotica. These bellies of the frontalis muscle supplied by branches of the facial nerve, which are responsible for its movement. Okay, the action of the frontalis muscle are raising the eyebrow, okay, making wrinkles in the forehead region, and also it is responsible for the expression of the surprise or horror. Also we have occipitalis muscle. The occipitalis muscle originated from the superior nuchal line of the occipital bone. It is inserted into the Gallia aponeurotica. Okay, so you have to know the origin insertion of these muscles. Now we will talk about the lymph drainage of the scalp. The interior area of the scalp drained into the submandibular lymph node. The posterior area drained into the occipital lymph node, while the lateral area, if it is superior to the ear, it is drained into the superficial lymph node of the parotid gland. But if it is superior and behind or posterior to the ear, it is drained to the mastoid lymph node. Okay. Now we will talk about the arterial blood supply of the scalp. There are 5 arteries which supply the scalp. 2 from the internal carotid artery, which are the superior trochlear artery and the supraorbital artery. These arteries are branches from the internal carotid artery. The other 3 arteries are the superior superficial temporal artery and post-auricular artery and occipital artery. These are branches from the external carotid artery. Okay. The venous drainage of the scalp to the vein have the same names of the arteries. Okay. Finally, we will talk about the sensory innervation of the scalp. There are 6 nerves which innervate the scalp. First, supratrochlear nerve and supraorbital nerve. These two nerves are branches from the ophthalmic division of the trigeminal nerve. Also, we have two nerves which are lesser occipital nerve and greater occipital nerve, which are branches from the cervical plexus. It innervates the skin over the scalp from posterior area and lateral area. The supratrochlear nerve and supraorbital nerve supply the interior area of the scalp. Also, we have zygomato-temporal nerve, which are branches from the maxillary division of trigeminal nerve. It supply the temporal region. And also we have auriculotemporal nerve, which is a branch of the mandibular division of trigeminal nerve, supplies the temple region. Okay, so anteriorly we have supratrochlear, supraorbital. Posteriorly we have lesser occipital and the greater occipital nerve. Laterally or over the temporal region we have zygomato-temporal and auriculotemporal nerve. The motor innervation is through the branches of the facial nerve. Finally, you have to test yourself, okay, about the nerve supply, the blood supply, the venous drainage, and the lymph drainage of the scalp. Thank you all for your listening, and these are some references for our lecture.